I record?
Go for it.
Do you care if I live stream on Facebook?
Go for it.
Okay. Let me try to set that up quick. Okay, going live.
Hi, everybody.
All right. Good afternoon, everyone. My name is Danielle Angelari, and I'm the Executive Director of NAMI Northern Illinois. We're an affiliate of the National Alliance on Mental Illness that serves Winnebago, Boone, and the surrounding counties up here in Northern Illinois. I just wanted to start with a couple of things before introducing our presentation today. So today we're closing on Mental Health Awareness Month and our Mental Health Month Challenge. To remind you, for our final day, we are challenging you to reflect and to really think back on all of what you've accomplished this month and to make a plan for using some of those tools moving forward. This seems very relatable for our program topic today as well. Reflection gives our brain that opportunity to pause amidst the chaos, untangle and sort through experiences, and then create meaning. And this meaning really develops how we learn and inform future action. And even though the month is ending, we do encourage you to live every month like it's Mental Health Month and to really take care of yourself and others. And I do have one reminder, and that's just for our annual event, which is coming up on Monday, and I have no idea how we got to this point so quickly. And that's June 6th at Forest Hills Country Club. Come on out for golf and the after hours dinner if you don't golf. I'm sorry, Mary, I don't know why my speaker is. Does that one sound better? Possibly. Do I sound really echoey to you, Jason?
A little bit. Not horrible.
Okay. How about now? Same? Okay. Apologies. But now I want to introduce you to Jason Holcomb. Jason is a purpose-driven leader with a tenacious passion for mental health. Having worked many years in the community mental health and disability sector, Jason sees mental health as foundational to the success of a community. He has been trained in multiple collaborative approaches and brings a collaborative innovation lens to funding, project development, and community building. Currently, Jason serves as Director of Community Impact for Region 1 Planning Council, and through intergovernmental agreement manages the day-to-day operations of the Winnebago County Community Mental Health Board. He has a master's degree in social work, focused in leadership from Indiana University School of Social Work. And Jason's here this afternoon to talk to us about the Mental Health Board, its history, its mission, the accomplishments they've made so far. Thank you, Jason, so much for joining us today. And I'm going to hand it over to you with one quick mention to the audience that we're in a webinar style. So if you do have a question, please ask it in the Q&A feature and we'll facilitate at the end. Thank you.
Thanks, Danielle. I will share my screen. All right. Well, this says Mental Health Board grants. We're going to talk a little bit more than just grants today. And I've put together probably the longest version of the presentation that I've done to date because we have so much time here. But with that being said, I apologize if you've seen some of this before, but I'm going to kind of cover the whole history of the Mental Health Board and then get to where we are today. But before I start with the Mental Health Board history specifically, I'm going to go a little bit further back to kind of understand the context of why we even have a mental health board or why that type of mechanism even exists within counties and municipalities across the state of Illinois. If we go back to 1950, when Thorazine was introduced, or so to say tested for the first time as a psychotropic medication, that kind of created a bit of a mental model shift or a paradigm shift within the mental health world, in that prior to that, people with serious mental illness were mostly living in hospitals, what they called asylums at the time. And when Thorazine, it had such a good initial response. In some cases, there's stories of people that were delusional or psychotic, sitting up and having coherent conversations with the staff. And it was kind of a moment of feeling that this was this miracle drug that was now going to allow for people with serious mental illness to live and recover in their communities. And while the full benefits of medication were a little more complex than that in terms of there being side effects, and Thorazine now is not even on the market because of the significant side effects that it causes, but certainly introduced the potential of psychotropic medication having an important role in the recovery of people with mental illness. In 1963, I believe that John F. Kennedy signed the Community Mental Health Act into law that eventually led to some funding sources for community mental health services. And by the early 70s, there was a growing body of research to try to understand, in addition to medication, what were the other types of supports that somebody with serious mental illness would need to live and recover in their community. And so this community support system model that you see here, in this kind of wheel with these different spokes, was this emerging model from research of that period of time that demonstrates what these different services are needed to wrap around an individual with serious mental illness to live and recover in their community. Now, obviously, these things aren't limited to just people with mental illness, and somebody without mental illness also needs housing and also needs, in some cases, rehabilitation services or at least employment. But some of these are very specific to things that a person with mental illness might experience, like a crisis response, specifically for a mental health crisis. And so I don't have the history slide on here, but if we fast forward then to the early, like 2010, there's been 3 different bodies within Winnebago County that have done research and advocacy, and all of their research has demonstrated the need for a local coordinated system of care, and they've all agreed on supporting the community support system framework as the model to try to build within Winnebago County. And they also agreed that there would be the need for a local fund in order to build this, that there's too many gaps in state and federal funding to build this comprehensive system of care only with those funding sources. And so that is what eventually led to the establishment of the Winnebago County Mental Health Board, and also placing the half-cent sales tax on the ballot for voter approval in March of 2020. We then went into a strategic planning process to say, okay, so if the goal is to build the community support system in Winnebago County, what are the gaps that we currently have? And so one of the things we did is we surveyed a number of providers of service, and we received response from over 50 agencies that provide substance abuse and mental health services. And they all kind of gave us very detailed information on what their current capacities were, the strengths in their various areas of service delivery, and also the areas that there were gaps. And so that was one part of our environmental scan. And then the other part of it was allowing residents to give their impression of services in terms of what they believed were the highest priority areas. And so you'll see now on this chart here that I have up the results of that resident survey. And on the left-hand column, you'll see those colors match up with the different components of the community support system. And within each area, there's the specific services identified that connect with an area within the community support. So for example, I said housing earlier. You'll see there's the dark orange color. It shows supportive housing and residential assistance. Those are the 2 service areas within that housing category in the community support system. And so this chart also then at the top disaggregates that data by different demographic characteristics or population characteristics. So for example, you'll see education, we disaggregated that data to see, does the perspective of somebody with no high school degree or with just a high school diploma, no college degree, does that match up with the perspective of somebody with a college degree? Do across the gender spectrum of male and female, is there a shared perspective between male and female residents within Winnebago County about what the top priorities are? And perspective as well was an interesting one. So does somebody who's living with mental illness or have a family member living with mental illness match up with the perspective of somebody who's a provider of services? And how do those compare to residents within Winnebago County? And then also you see a racial and ethnic breakdown between white and non-white. And we could have further broken down the non-white category, except the response rate was so much lower that we categorized that all together so that we would have a big enough sample to keep that relevant. So anyways, as you're looking at this, it's kind of mosaic, and you're seeing like orange and green across the board in different areas, orange representing lowest priority, dark green representing highest priority, and then you'll see a couple of shades in between that. But you'll see a few areas where there was high priority across all perspectives. And so, for example, the crisis response services, which includes here crisis telephone, crisis walk-in, crisis outreach, and crisis residential, that's pretty green across the board. Clinical components of treatment, diagnostic evaluation, supportive counseling, medication management, substance abuse, completely green across all perspectives in almost every one of those categories. And so we used both components of that environmental scan and then evaluating research from all community health plans over the past 5 years to develop priorities for funding with the half-cent sales tax. And so there's 6 priorities in total for the first 3 years of funding. And then you'll see for each priority area, there's an additional breakdown into the specific service areas that are included for that component of the community support system. There's target population, so who specifically are we trying to reach with these services? And then there's some intended outcomes, and there's different types of outcomes from the system capacity outcomes. So again, going back to creating that coordinated system of care and identifying what the gaps are in our current service delivery system, we identified what are the things we want to see improved. So increasing the number of providers, decreasing the wait times, those kind of interconnected with one another. Allowing better payment options so that nobody with Medicaid or nobody with that doesn't have insurance is finding that they don't have a place to go. Making sure that there's improved accessibility, both for actual physical disabilities or any type of disability, ensuring that the spaces that are available allow for anyone to access that service, but also geographic accessibility, making sure people living in a neighborhood that might be a little more disconnected from where the services are, that they have transportation or some way of getting to the services. Increasing hours of service. So in some cases, because of the funding availability, some programs are only able to offer services from 8 to 5. And we've now seen the expansion of services into later hours or on weekends. Increasing mobile services. So again, that connects with that accessibility part. If you're in a neighborhood that doesn't have the service there in your neighborhood, how are we getting to you, or making sure the transportation is available for you to get to the service? And increasing translation services. So these are various types of system capacity outcomes. Not every program is going to meet one of these specific outcomes, but they'll connect to at least one of them. And then the question is, so when the system is improved, how is that going to impact individuals and families who are living with and dealing with mental illness and substance abuse. And so just some examples there would be, in addition to persons served, actual symptom improvement, maybe increased education or employment, decreasing criminal justice involvement, and increasing housing stability, and then also perceptions of care. So what are those client satisfaction numbers showing in terms of how the users of the service actually feel that the service helped them? And then lastly, and these are going to be longer term outcomes that will happen over the course of several years, is those community impacts. So what are those actual population level changes that we expect to see over time as a result of an improved system that serves more people and provides better outcomes for individuals and families? We would expect at a community level that we'd see a decreased suicide rate, a decreased rate of death from opioids, less incarcerations for people with mental illness, and less people who are homeless due to mental illness or substance use. And so you'll see that across 6 different priorities. It includes mental health treatment, case management, crisis response services, family and community supports, client identification and outreach, and housing. Okay, I'm going to take a break because that was a lot. So for our first year of funding, the tax, again, as I mentioned, was approved in March of 2020. It didn't start getting collected till July 1st of 2020. And the first grant year, I believe we started taking applications in January of 2021 and made approval decisions in April of 2021. And then programs, many of the programs started, the first program year started June 1st of 2021 and goes through May 31st of 2022, which is today. So today is actually the last day of the first year of programming. So for the first year of programming, we awarded $8.8 million to cover the first 4 priorities. Because we didn't have a full year of funding, we tried to just go with the top 4 priorities in the first year and then added priority 5 and 6 in the second year, which I'll talk about later. So those top 4 priorities, and then for the target populations of infant and early childhood mental health, serious emotional disturbances, which is for ages 3 to 21, serious mental illness, which is for the adult population, and then substance use disorders across all ages. There are 15 programs that were awarded in the first year of funding, and you'll see here on the left-hand side, the lead agency for each funded program. Some of them are collaborations, so please keep in mind, just seeing the lead agency name does not mean that agency itself got all of that funding. In some cases, many of these were collaborative proposals. And then on the right-hand side, you'll see the amount that went to each one of the priority areas. That's an estimate. Some of these priority areas are interconnected, so you can't completely separate them from one another. But in general, this is what we believe, based on each agency's proposal, that generally speaking, this is the approximate amount of funding going into each area. The other thing I want to note here is that some services are more costly than other things. So it was not intended to balance all of these 4 areas with 25% of the funding going to each. Family and community supports, for example, a lot of that's event-based. So it's going to be like community events to increase awareness, where you might serve in one event 100 different people, whereas in a mental health service, you might have one person that's seeing a psychiatrist at a higher billing rate than what that community event might do per person. So it was anticipated. If you even look at some of the research that was done in Winnebago County in the early 2000s leading up to the tax, there was even some estimates then that were pretty close to this in terms of how the funding distribution might look into these different priority areas. As we look then at funding distribution as it compares to the target population, so who are we actually serving, and is that proportionate with the people living in Winnebago County? On the top layer here, you'll see estimates of who would be served in each of those 4 target populations based on the funding proposals, overlaid with a actual population distribution by age for Winnebago County. So in Winnebago County, 75% of the residents are adults and 25% are children. And if you look at our populations served estimates, you'll see that roughly about 62% was for adults with serious mental illness, 17% for kids with mental illness, severe emotional disturbances, and then that substance abuse group is broken into children and adults. So it's pretty proportionate across the board with who actually lives in Winnebago County, except for one area, and that's the infant and early childhood mental health, where the target numbers served were less than 1% of the numbers for all of the programming, whereas 7.2% of the actual people living in Winnebago County are under age 5. One of the reasons for this is that infant and early childhood mental health is actually an emerging, innovative, and kind of newer service area within the mental health field in terms of a focus area. And so that's going to take some time to build the capacity around those types of programs. And we do hope to see that increase in future years of funding. I'm going to, because we have so much time today, usually don't go through all of the programs individually that were funded in the first year, but I will go through those briefly. As we're talking about early childhood and infant mental health, this first program, Children's Home and Aid, the Winnebago County Doula program, is one that is focused on early childhood and infant mental health, and actually even prenatally, so working with mothers who are pregnant to provide them supports while they're pregnant, but then also in the early stages of infancy with the childhood, with the infant, to try to help the caregivers, primary caregivers, build healthy attachments with their child at an early stage, which can be preventative in future years from developing emotional disturbances and mental illness. Children's Home and Aid actually had 2 programs funded in the first year, and the second one is another early intervention type program that's focused on elementary age students and providing mental health supports for that population, and in some cases being able to provide those services on site at different schools. So they have a partnership currently with Harlem School District to be able to provide those services on site, although the program is open to all elementary age students within the target population within Winnebago County. The City of Rockford, here's the one that, as I was mentioning, those collaborative programs, City of Rockford is the lead agency for this, serving as the fiscal agent for the project. But it's really a partnership between 3 different law enforcement jurisdictions, along with Rosecrans as the behavioral health provider. And it is a mental health co-response program that is able to provide crisis response to somebody who is experiencing a mental health crisis, but also does follow-up and connections to services, particularly for those who become justice involved due to their mental health crisis. So reviewing 911 calls, and in some cases even going to court and providing and doing some advocacy to the judge to help them understand the mental health components that maybe led to a criminal charge, and in some cases then helping the court system to be able to connect people directly to mental health services when that's the more appropriate follow-up for their whatever justice involvement they have. The Crusader Community Health expansion of their behavioral health services. So, it's an expansion of service, but what's really innovative about this program as well is that it includes behavioral health services on site within a urgent care clinic. So at their West State Street location where they do have urgent care, they also have behavioral health staff that integrates with their physical health staff, so that if somebody's coming in with a behavioral health need, that they can make that immediate connection to a mental health clinician, in addition to scheduling those follow-up services. And they also do the MAT, medication assisted therapy for opioid disorders, and have case managers for that to ensure that that population, people dealing with opioid addiction, are making their follow-up appointments, and staying in services. Family counseling services was one that saw the physical expansion of their office, as well as expansion of the number of counselors that they have in office. And so they have a completely renovated I think third story, or like an entire different story within their office building, renovated the offices, was able to now have a dedicated play therapy room and a dedicated art therapy room in the offices, with additional therapists, which has helped reduce their wait times for services. RAMP, Regional Access and Mobilization Project, has basically been able to increase their advocacy. One of the things that they do as part of their funded program is provide assistance for students that have mental health or substance use issues, in developing individual education plans, IEPs, within school districts, so that people who are having a disability due to mental health issues can have the appropriate supports that they need and are entitled to as a result of their disability. Remedies Renewing Lives also has two funded programs. One is focused on their domestic violence shelter, where they now have a full-time mental health clinician available there for survivors of domestic and sexual violence, to when they also have a mental health need, that they're able to have that mental health need met within that shelter area that they are accessing due to their domestic violence situation. And then secondly, they have one that is more focused on their substance abuse clientele and providing case management services for that population, helping them stay in service and connect to the various services that they need. Rockford Sexual Assault, they have an additional counselor therapist that's specifically focused on children who are survivors of sexual assault, and providing a therapeutic services to help them with trauma symptoms as a result of that. Rosecrans Access to Care, this was the largest funded program from the first program year. There's kind of like three different programs built into this broader program, or three different components to it. One is the expansion of actual psychiatrists. And again, this is one, if you go back to all those previous years of community research and reporting that had been done, children's psychiatry in particular was always a huge community gap that was demonstrated in any survey that had ever been done, or any report that had ever been done. And so we are happy to say that this program has expanded the availability of child psychiatry throughout Winnebago County. Another critical component to this was the expansion of the ability for the crisis residential facility that Rosecrans has to be able to do assessments 24 hours a day, 7 days a week, 365 days a year. So as we talk about the importance of co-response for crisis and that co-responder program, that can only be successful if there's a place to take somebody when they're having a crisis, a mental health crisis. So as we see the kind of decreased number of hospital beds we have in our community, this program becomes so much more important, because if there is somebody that's having a mental health crisis at 2 a.m. and they get the co-response that they need, but then need a place to go to have treatment, this crisis residential facility is that place. And now they are able to provide that assessment any time of day and coordinate with programs like the co-responder program to have a drop-off location. So very important. Shelter Care Ministries has expanded their services. They've had a drop-in center called Jubilee Center for years, where people with serious mental illness, specifically who are in the homeless population or have recently been homeless, go to connect with one another, but also receive services. And they were able to add a full-time coordinator who is just able to help serve more clients at that location. Stepping Stones actually expanded their physical facilities and purchased a new counseling center that they recently had a ribbon cutting ceremony for, and I was able to attend that. It's a really beautiful facility. And the cool thing also here is that for the first time with this new facility and this funding, they will be able to provide services to children. And that's an area that they had previously not provided services. So we're really happy with that expansion of services for children. University of Illinois College of Medicine. This is a program focused on the criminal justice reentry population. So people coming out of jail, making sure there's continuity of care. So they're coming out of jail, making sure those medications that they may have been taking in jail are continued and renewed out of jail, and that there's no gap in service. Of course, that's really important for decreasing recidivism for people who maybe are being chronically incarcerated due to mental health issues. And again, so as I'm talking about that one, another kind of importance of coordination of services here as we talk about the funded program at the Winnebago County Jail, where they have a full behavioral health team now on site at the jail providing mental health services, including psychiatric, like medication prescription, but also counseling and group counseling. And they provide that in the jail and then coordinate referrals to the appropriate provider. In many cases, it might not be the College of Medicine, but when it is appropriate, then making that warm handoff to the College of Medicine for the continuity of care there. And lastly, from the first year of programming was Youth Services Network, their youth trauma clinic. So they were able to really build a youth trauma clinic that's fully staffed with, I think, 5 therapists, completely focusing and dedicating services to youth that have experienced trauma and now are having significant symptoms from that are impairing their social or educational functioning, be able to provide them with a dedicated team of trauma-informed therapy. So 15 programs, and you kind of got to hear a little bit about the scope of work. I'm going to now share with you some of the outcomes from the first 3 quarters of programming. Of course, we have not fully evaluated the final quarter of programming, which ends today. And for each one of these programs, they were required to develop some outcomes that we assisted them with that connected back to that 3-year strategic plan and the priorities that I showed earlier in the presentation. And so you'll see the progress over 3 quarters here in the various categories of completed outcomes, outcomes that were being delayed for some reason, those that are in progress, and things that have not yet been started. And so you'll see a significant increase in the number of completions and those that are in progress, and a significant decrease in the number of outcomes that are delayed or have not yet been started. Also here, you'll see then performance indicators as it relates to filling of positions and the amount of funding that has actually been distributed through Q2, so at the 6-month mark, about only 1/3 of the positions had been filled, and 2/3 of the approximately 85 positions created were still open. That is largely in part because we have new programs that are building capacity, but also because we are experiencing a behavioral health kind of workforce shortage that has reached a crisis point. And so it is very hard nationally and within the state of Illinois, and certainly locally, to fill mental health positions. There are not enough qualified and credentialed mental health workers to fill all of the open positions across the nation. So that's been a challenge for us. And you'll see that the spending has not been, so through the 6-month mark, we had not spent half of the funding. We'd only spent about 20% of the funding because we're only reimbursing for expenses that have been paid. So when we're not filling all the positions, then we're not able to spend all of the dollars. What I am happy to report, though, is that while I don't have it visually presented here on the slide, at the 9-month mark, so 3/4 of the way through, on the positions filled, that actually flips. And we'll see that 2/3 of the positions had been filled at the 3/4 mark, and only 1/3 of the positions were still open. So Q3 was a really important month for hiring. And so we anticipate then that will increase the spending, especially here in Q4, and get us closer to what we're awarding in funds. Another good news in this is that the funds that don't get spent stay in the mental health fund and are dedicated strictly for mental health services in Winnebago County. So it's not like because this money didn't get spent on mental health services, it's going to go to something else. It will stay in a dedicated mental health fund, and it will just be used in future years of mental health programming. Now, if you can kind of remember back to an earlier slide that I had on what was anticipated for in those proposals about who would be served, now we can actually see who's actually been served. And so you'll see Q1, Q2, and Q3, who's been served in each of those target populations, and then what the total unduplicated number of persons served is for each quarter. So again, not surprisingly, we're seeing an increase in numbers served. From Q1 to Q2 was a big jump. It kind of plateaued a little bit into Q3, but we do see that largest number is those adults with serious mental illness, followed by severe emotional disturbances. In Q3, there was actually a big jump in substance use persons served, to the point that it actually exceeded the number served for children with severe emotional disturbances. And then, not surprisingly, infant and early childhood, you'll see, are at the lowest number there, but we do see some increase there from Q1 to Q3 as well. And then just to give you a quick preview of what's ahead, well, let me wrap up the outcomes by saying, again, today is the last day of program year 1, so we'll get those final reports from everybody in the next month, and then we'll be analyzing and producing a year 1 program report that will show more detailed outcomes for each program across year 1. And we'll be happy to share that with the community when it's available. For this next program year, which so the second year of programming, we had a full year of funding. So we're able to increase our funding allocation or awards up to $14.6 million. We included those 2 additional priority areas, priority 5 and 6, of client identification and outreach and housing. And we kept the same 4 target populations. And we awarded a total of 31 awards, which included 16 completely unique new programs and 10 new lead organizations. So we're proud of that as well, because it was our intention to try to expand and creating this coordinated system of care to ensure that there were more programs, but also more organizations leading those programs. So it wasn't isolated to only a handful of organizations within Winnebago County, but we believe to reach all of the people within our target population, we really need all hands on deck, and we need a lot of different types of organizations to be involved while keeping the programming specific to the types of services in that community support system framework. And then just as a how to stay informed, we do have a website, and we have a number of different social media platforms that you can follow along. And probably the most important way is that you can sign up for that email list on the website. There's an email sign up where you'll get updates on anything that's going on. All of the board meetings are live streamed on YouTube, so you can always hear the most current information. And you're always welcome to sign up for public comment as well for those board meetings that are held on the second Wednesday of every month at 2 p.m. Sorry, the first Wednesday of every month at 2 p.m. Those are in person at the Region 1 Planning Council or live streamed on YouTube. And so do encourage you to check out these various communication avenues as ways to stay up to date with all of the things that we're doing at the Mental Health Board. And I will take some questions with our remaining time.
Thank you, Jason. That was a ton of awesome information. Appreciate your time today and sharing with everyone.
I can't believe that I actually did a 40-minute presentation. I don't think I've done one quite that long yet, so I just tried to put all of our slides together in one and see how long that would go.
It was wonderful. We have a question. Is there funding available for smaller or more immediate needs in the county?
So smaller needs is, I don't want, so a lot of the programs that are being funded by the Mental Health Board are smaller. So there is a range from very small programs to very large programs. I think the smallest award last year, or maybe even this year, might be around 40,000. So that's less than one full-time staff. So I think that the current funding does allow for small and big programs. But in terms of addressing those like emerging needs or things that happen maybe outside of the funding cycle, that's not something the Mental Health Board currently has a funding program for. It's been in the conversation as something maybe in the future as we get more established with this grant program that we might open it up to those types of emerging things. But for right now, that's not one of the funding opportunities for the Mental Health Board. So I suggest looking more towards some of the local foundations like the Community Foundation or others that have funding cycles that are more frequent, or in some cases have emerging needs type of funding mechanisms where they can take an application at any point in time for something that pops up as an emergency type issue.
Thank you. Are there any other questions? I know Jason's got all the answers for you, so don't be shy.
While we're waiting for more questions, I'll just add that we're currently in process with our newly funded programs of getting work plans and funding agreements signed for everybody. So once we have all of those in place, then we will do some type of community event or community announcement to give more details on what those new programs will be. But as we're kind of finalizing those work plans, that's kind of where we're at in that process, I should say.
Sure. Jason, do you mind if I have a copy of your PowerPoint to share with maybe people that were able to attend and those that signed up that couldn't?
Yeah, no problem. We're happy to share that. I think we have a somewhat close version to it also on the website, but we're happy to give out a PDF for anyone that would like to see it. Yep, no problem.
And you don't mind that I share your contact information again? Also want to follow up.
Yeah, please do, and we'll include in those last slides, there are the different ways that you can follow along on the social media and email, so that people know how to have your questions answered or how to get the most current information.
Another question, can you touch on the grant application process for the future?
Well, I can't really too much for the future, because I don't know that every year it will be the exact same. What I can say is that in the first 2 years of funding, we focused on those top 6 priorities, and we fund according to a 3-year strategic plan. Our strategic plan gets updated every 3 years. So for this next year, we'll be in our 3rd year of planning, which will be on the 3rd year of funding. So it'll be for those same 6 priorities that I mentioned and the same target populations. I'm pretty confident about that. But in terms of what the timeline will be, I would imagine, this last year, I think we did the first year of funding. I think the grant application opened January 1st. And then the second year, we try to make it a little bit earlier to give people more time to write their applications. And I think we did it November 1st. So I would say the period of time to kind of keep an eye out for that would be October, November. We will get a county board budget approved in September, very likely, and then our fiscal year starts October 1st. So that then allows for, once we know how much funding we have, then we can kind of make those decisions about what the funding process specifics will be for year 3.
Thank you. I don't see any other questions yet. But I'm sure if people had questions, they can reach directly out to you. Okay.
Sounds great.
Awesome. Thank you, Jason, and thank you everyone for attending today. I hope you all have a nice short week.
Thank you, Danielle.